Dr. Claudia Perez Tamayo here with Central Care Cancer Center, talking about breast cancer. You're dressed in pink, which is appropriate. It's a big topic of discussion this month, and you have some important information to share with people. What is that?
Thank you, Natalie. Well, it's a very common cancer. 1 out of 8 women, and actually men also have cancer, the breast, 1 out of 10. If you're a mammal, you can get breast cancer. And there's many risk factors, but the important thing is early detection can really make the difference. If you are in stage 1, you are almost 100% assured that you're going to get treated and win. If you're at stage 3, then the survival goes to 25% less.
And we have these percentages for you, here
Yes.
on the screen.
So you can imagine stage 3 it means that it has gone into the lymph nodes, and that's 30% of the patients are diagnosed at stage 3 at the first. So that's a lot of people that have lost the opportunity to be in that 99% of cure.
Well, and a lot of times people, I think, are hesitant to go to the doctor. They think, oh, I'm fine, I'm fine, I'm fine. How do you know it's time to get checked out? How do you prevent yourself from getting this spotted at stage 3, which for many is too late?
Well, there are screening guidelines that your primary care physician will absolutely do, but you know your breast better than anybody else. You find a little knot, it's better to check it out and see that it's nothing or something.
So we have this list here that you provided us, monthly self-exams, knowing what's normal, staying with your doctor, and then what about, you have some recommendations for women after 40 as well?
Yes, that's when the cancer is more prevalent. So you do want to stay, you want to have annual mammograms at that point. But if you have any family history of breast cancer, you need to start earlier, because that can be an indication that you're at higher risk. And there's other things that can put you at higher risk. So I think that if you have any concerns at all, talk it over with your primary physician and they will guide you. But absolutely after 40, you need to check it out.
And let's go ahead and show these numbers again, men versus women. I believe we have some statistics on that if we can get that pulled up. 1 in 8 women and 10% of men. You don't think of men and breast cancer very often. And this has been kind of problematic for men. They're talking about getting men more involved in clinical trials, right?
That's exactly right, because usually, incredibly enough, they're actually more advanced stages. And even though you would think it would be picked up easier because the breast tissue is a lot less, they're not. So it's not that it's usually more advanced, it's that usually there's a genetic component to it. But there are women in other countries who have a less chance of having cancer of the breast, like the Asian population, and when they move to this country, their risk goes up to the American woman. There are risks here, and most of it is stress.
And that could be a whole different topic for another day.
Exactly.
I think we should come back to that. Well, thank you so much, Dr. Perez Tamayo with the Central Care Cancer Center, always here on the first Monday of every month to share some important information. We'll be right back.